Subscribe to Awaaz today. Click on the bell icon for latest national and international buzzing news.
Fear of pregnancy, a lot of miscarriages happening, fault defects in pregnancies, and developmental delays, intellectual disability, autism, and some birth defects. All these can be perhaps avoided with proper testing. And sometimes we hear about couples with history of multiple unexplained deaths of previous child, or even high risk abnormalities in children, and ultrasound during pregnancy. So why should we put a woman's and child life at risk with incomplete information, decisions about yours and yours family health? And with this fantastic facility, the Apollo Genomics Institute, now that it's here with us, so they are aiming to provide most comprehensive and multidisciplinary care for patients and families suspected of genetic disease. So I hope,
It is indeed a great honor to stand before you this afternoon. I stayed up late last night wondering what I'd say to this august assembly. Obviously, I'm deeply touched to be recognized by this foundation. But I have come here today to express another dimension of my gratitude to Mrs. Sharmila Tagore, our guest of honor, and Dr. Sangeeta Reddy and Dr. Anupam Sibbal. Over the last 5 decades that I have been practicing pediatrics, there has been a paradigm shift in medicine from preventive to precision medicine, largely because of the scale in the genomic revolution. The purpose of this venture at the Apollo hospitals is to provide genomic services to Navi Mumbai and beyond, and serve as a reference center for Western India. We will strive to deliver high-end quality genetic services to our patients. Now there are generation sequencing is considered the biggest advance in health science since the introduction of radiology. And then gene therapy, as we all know, has become the new magic wand for treating genetic disorders. India is presently in the cusp of a genomic revolution, and we must strive to bring genetic services of international standards within the reach of every individual. Having a genetic center of excellence at our institute for investigations to make a diagnosis. Next. So we need to have a multidisciplinary approach, and that's what we have been doing at our institute. And you can see that my diaries is still flowing there. We make notes. I've been doing that for the last 50 years, and I'm still making notes of every case that we have. And the next slide, please. So genetics indeed, as we have said, has been the past, will be the present, and is the future of medicine. And as I said, if you don't know your genetics today, you're not going to be knowing your medicine and the future of medicine. Our country, 10,000 thalassemics are born every year in our country, and it's quite despicable that for the last more than 20, 30, 40 years, nothing has been done by us, by the health services. But we are going to be starting a genomic thalassemia center at our institute. One thalassemia is born every hour. By the time we finish this session, one thalassemia will be born. And the next slide. We cannot forget, when we are talking about genetics, about this little creature. This mouse is responsible for everything that we have done in research.
On to the dais, I'm here to introduce few of the aspects of Apollo Genomic Institute's Navi Mumbai, what we have tried to establish and what the way ahead. So Apollo, as we all know, that has already established world-renowned quaternary center. So, and we have spread across 7 lakh square feet. We have a huge area in which we have 120 full-time specialists and super specialists and more than 400 beds which are catering to all these patients with excellence of care from various clinics like cancers, pediatric institute, maternal and fetal care. Some of our experts are sitting on dais, Dr. Givle, who is handling pediatric care, and some of them are sitting in the audience. So all these institutes, and because genetics is now spreading and spreading to every specialty when it comes to diagnosis and precise diagnosis. So we have this care already in place which gives care for patients for management, and genetics is going to be at the helm where we help them to give precise diagnosis and direction for management. We also have already established pediatric team and intensivist care at Apollo hospitals under Dr. Gevle. So we are already catering to these high-risk patients, and genetics is going to give them an edge. We also have fertility experts to provide us a new facility which is already established here, the implantation genetic diagnosis. Then cancer genomics, and we are in process of setting up that clinic of cancer genomics, especially as they have said important in breast and ovarian cancers.
Only 18 months ago we were just beginning. Now we've got a series of genomic medicine institutes. I think what Dr. Rashid introduced and Dr. Ismail just added, we have to start from the many examples from the patient perspective. And there is no age bar here. You can have a baby before birth, now it's very old. So I think the field of genomic medicine is very vast, multi-system, as we have been introduced today. And so it all depends what is the question asking the patient or the person within the clinic or in the ward or anywhere else. So moving on from the patient perspective, then you have got different categories of people who will benefit or who benefit from a genetic consultation or input or what we call genomic testing now. I mean, first of all, the unfortunate parents who already had a child, they are worried about the risk of it happening it again. They want to know all options which we have got now in terms of the precise diagnosis, what is their risk, and what could be done in the pregnancy at different stages, or even to the extent of the pre-implantation genetic diagnosis, what we call the precision embryo diagnosis. And
I think as we understood, genetic indispositions are coming from multiple variants in terms of the overall thing. Oncology is one of the key contributors. Newborns, new kids which are getting born, they are immunocompromised in terms of those are the element. Pediatric obesity, NCD, non-communicable disease as we call it, is another important contributor to this thing. Within Apollo system, we have been catering the intervention part of it. So when we talk about pediatric cardiology or we talk about liver transplant in pediatric cases, these are all an outcome of genetic indispositions in the family in terms of overall thing. Onco, what we talk about. So based on that kind of thing, we wanted the disease profile to be caught a little earlier. That's the reason we are getting into a big way, getting into therapeutic, getting into diagnostic. Apollo is setting up a significantly massive scale lab in Hyderabad, where we will be doing our own testing now over a period of time. It's work in progress at this juncture, and Fortunately, Apollo with JCI accreditation and other accreditations that we have are blessed and fortunate to have best of the clinicians on board. So it's a multidisciplinary approach, as Dr. Rashid was trying to highlight. It's a blended approach of all the consultants who talk together, look at the case profile and intervene at an early cost. Because a lot of kids that we see at the hospital.
They are part of some established neurological disorders, yes, they are part of genetics, but as a whole, psychiatric disorders are not completely established as genetic and non-genetic. So really we have to see case-to-case basis whether it is part of a genetic condition or it is completely non-genetic and a psychiatric condition. So that differentiation needs to be where our clinicians and teams come. So when we make that distinction that whether this disease is genetic, it will come to us and we will find out the genetic cause. Even if the family history is there, sometimes the specific genetic cause sometimes is not known. So really that needs an expertise to differentiate between this, and then we take a call whether it is genetic or not.
See, you are talking about psychological problem.
Yeah.
Now, one of the common psychological problems that we face in children, and now it is an outburst of it in our country and everybody knows about it, is something called autism. One would have heard about it if it's so common to have autism. 1 in every 100 child seems to have autism. Now, a large number of autistics, which were called schizophrenics or psychological disorders, have a genetic association, Predisposition. Not a predisposition, a genetic cause for causing their autism. You understand? So, so there is something like autism. When we have autistic children, and if we find there's something unusual about them, then we ask for genetic test. Not that we ask every autistic child to do a genetic test, but that comes into that's where I said the importance of a clinician comes in. You know, we just don't do tests. You need the brain behind, the clinician behind looking at it. So the clinician is more important than just testing. Yes.
Actually, we have to walk between that path.
And you walk with it, yeah.
And anxiety.
Yeah, and then we do it together. So that's the good thing that our hospital is doing. That we have a multidisciplinary. We all sit together. You saw that film where and where is Gauri? We all sit together and counsel the patient together as a group. She as a geneticist, she as a counselor, she as a geneticist, I as a pediatrician, what I would look at overall. You know what I mean? Yeah. So that's it.
The
COVID and infection should be addressed to Dr. Vijay Yavle. He is a specialist in infectious diseases, and the man knows a lot on COVID. So ask him.
He's a sitting member of the COVID committee also. Yeah. Talking about COVID and infectious disease.
तो जीनोमिक्स ये जो टर्म हम यूज़ कर रहे हैं वो ओवरऑल इंटरैक्शन ऑफ जीन्स. सो जो बहुत रेयर बीमारियां हैं वो भी जेनेटिक होती हैं, और बहुत सारी बीमारियों में अब जेनेटिक कॉज साइंस ढूंढ रहा है. सो ऐसी बहुत सारी बीमारियां हैं जो रेयर भी है और जो कॉमन भी है. सो वहाँ पे जीनोमिक आता है जहाँ पे हम जेनेटिक रिस्क ज़्यादा होंगे वो फैमिलीज़ को भी बुलाएंगे. ऐसे कपल्स होंगे जिनको प्रेगनेंसी प्लान करनी हो और उनकी प्रेगनेंसी हाई रिस्क है कि नहीं ये ढूंढना हो, वो भी हम एड्रेस करेंगे. प्रेगनेंसी के डिफेक्ट्स, प्रेगनेंसी में जो टेस्ट है वो भी जीनोमिक्स में एड्रेस करेंगे. और छोटे बच्चों में जो बहुत सारी बीमारियां होती है जो जेनेटिक हो सकती है उनको भी हम एड्रेस करेंगे. मेन एरिया कैंसर में है जहाँ पे जेनेटिक्स ऑल्सो जेनेटिक का बहुत सारा इन्फ्लुएंस ट्रीटमेंट पे असर करता है, वहाँ पे भी जीनोमिक्स आता है. तो जीनोमिक का जो हम बता रहे थे प्रेजेंटेशन में कि बहुत सारे डिजीज़ में अब ज़्यादा भूमिका उसकी नज़र आ रही है, तो उस हिसाब से जहाँ पे जीनोमिक की भूमिका होंगी जीनोमिक इंस्टीट्यूट एड्रेस करेगा. जहाँ पे जीनोमिक की भूमिका नहीं होंगी हमारे स्पेशलिस्ट भी हमारे साथ होंगे कि जहाँ पे ये डिजीज़ जीनोमिक नहीं है ये अश्योर करने के लिए फैमिली को मदद करेंगे.
Subscribe to Awaaz today. Click on the bell icon for latest national and international buzzing news.